Hi, welcome to Let's Talk Health. Hi, I'm Brian Finestein, CEO of St. Clare's Health, and I'm here with Dr. Singh, Medical Director of our Behavioral Health Program. So we're right now in the midst of the COVID pandemic, and we're seeing a lot of behavioral issues with our kids and their parents, and wanted to ask Dr. Singh a few questions as we move forward with this pandemic. So Dr. Singh, we've seen some behavioral changes with our children. What can you tell us is really going on?
So that's a good question. I'll just take a step back and mention when the pandemic started, rightfully so and understandably so, everyone's focus was on the physical health of individuals. But as is true with any pandemic, and history attests to it, pandemics are also significant in impacting mental health of both adults as well as children. And typically what happens, and this time was no different, that the mental health issues tend to be subtle at start, but then they tend to be chronic as well. So there is absolutely no doubt that we have seen an amazing impact on the mental health of both kids as well as adults.
So, with that in mind, what should parents or caregivers be trying to do to help our kids?
So first and foremost, I think the difficulty is in kind of trying to get a better handle on what exactly is going on with children. I wish there was a blood test that could be done which could detect that, you are stressed and you are not stressed. So I think education becomes very important so that parents know what to look out for. And what makes the thing a little bit more complex is that the presentation is going to change depending upon the age of the child. Mm-hmm. So just to give you a quick example, we don't expect a 6-year-old, or kids even younger than that have been impacted, to be able to articulate in words what exactly is bothering them. In fact, the younger kids, I would say 7 and below, tend to be more somatic in their presentation. So typically parents will start to hear there's a lot of headaches going on, or nausea has picked up. Kids are throwing up when they get up in the morning. And as they go along the developmental trajectory, they tend to become a little bit more concrete in their understanding of things. So let's say kids aged between 7 and 11, they may be in a position to articulate that they are feeling stressed or they don't feel well, but beyond that, a lot of them don't have the ability to elaborate on it. Mm-hmm. So more often than not, when the parent asks more questions, you get the response of, I don't know, I just don't feel well. And this is a time where other things such as there could be a change in their sleep pattern. Mm-hmm. So, if you talk to parents, they say, my kid used to sleep very well, but all of a sudden, the sleep architecture has changed. Either they're sleeping less or they're sleeping way too much. Mm-hmm. Similarly, there could be issues related to their attention and concentration. Now, look at the big picture, and part of the problem which this pandemic brought was it changed at a systemic level, it changed how things went. So schools became virtual for the most part, which added to the problem in the sense that it was very unclear how do you even assess for attention and concentration issues. I do digress a little bit, but the idea is that kids in that age group will tend to show you signs in other ways. Mm-hmm. They are just not enjoying themselves as much as they used to. There could be a change in their appetite. First and foremost, you could see them either gravitating towards more junk food because they come across as comfort foods, right. Or it could be just reduced appetite, or them having a ravenous appetite towards as the day goes by. So a quick summary would be a change from their baseline. Mm-hmm. is the body's way of telling the parent something. And the last age group obviously is that of our adolescents, and developmentally they are at that stage of their life where they develop the ability to talk in abstract terms. They can understand complex topics. So here, they obviously have the ability to articulate, but guess what? Parents are the hardest ones to talk to when you're a teenager, right? They're developmentally in the phase where they want They don't want their parents to be breathing down their neck. They want more autonomy. And if appropriate help is not available, then they are at a higher risk of experimenting with substances as a means to kind of treat their own anguish, their own stress. And as this pandemic has showed to us, there has been an uptick in use of cannabis, in use of alcohol, and so on and so forth. So a quick summary is parents need to be attentive to any change from baseline, and the symptom presentation is going to be different depending on the age group.
Okay. A related question. So, kids, young adults are going through a lot of changes. Is it important, are we distinguishing between the normal changes that you go through versus how COVID has influenced some of the behaviors?
We try to, but to be very honest, it does become very challenging because, as I had mentioned earlier, the whole system has changed, environment has changed. So what we used to, if a child is not reaching out to their friends in terms of play dates or hanging out with them, it is not necessarily a direct function or direct symptom of their underlying problem. They tend to isolate themselves even more these days, secondary to electronics and everything else. So the distinction has become challenging. The distinction has become, and I wish there was a playbook. Being a psychiatrist, I could just say, you know what, this is a checklist, but that's what makes the work, difficult at our.
So, Dr. Singh, I can appreciate the fact that being more attentive. I'm a parent myself. Mm-hmm. Assuming you feel that you are failing in the attempt to interact with your kids when you see them going astray, where should they get help?
So the general rule of thumb is, and I tell this to parents all the time, don't turn into your child's therapist. So, because if you start giving them more and more advice, the chances are even higher that they're going to push you back and they're going to become more oppositional. So I tell parents, outsource that job. Why do you want to take another thing on your plate? So for example, St. Clare's has a wonderful breadth of services at different levels of care. It could be at counseling services, it could be related to outpatient medication management, it could be partial level of care, or at the extreme, it could be inpatient level of care. Mm-hmm. But as a parent, my best advice is, when in doubt, when you feel that things aren't going the way they should, mm-hmm. leave it up to a professional. Go seek a consultation and get advice from them. In fact, in our general practice, we have noticed kids open up a lot more when they see the counselor or the therapist as an advocate for them and not as an agent of the parent, and then they get appropriate help.
Okay, thank you. One last question about children. Frequently they'll ask, when can I see my friend? When can I have a play date? How do you answer that in this very trying time?
Great question. I think first and foremost, it's best to talk to the child and explain to them why aren't they in that position at the moment. And the best way of doing it is to meet the child at their level of understanding. So obviously, the first message would be to help them understand what is coming in the way, because ultimately it's about the safety of their own health and that of their loved ones. Mm-hmm. In some ways, we are blessed to have technology, and we can use technology to our advantage, that just because they cannot meet with their friend doesn't mean that they cannot connect with them over the internet or over, and trust me, kids know a lot more how to do that than parents do. But I think once they have a better understanding that it's for the better good of everyone and for the community at large, the challenge, that's the first step of solving this challenge. And as the days and weeks go by, and within your own communities, it's also okay to create a little bubble of a group of friends who are also taking extreme precautions. So sometimes I feel taking a very extreme approach can also be detrimental. Safety comes first. That's the most important thing, but that doesn't mean that we need to have an extremely hard-lined approach.
Fair enough. Let me shift gears a little bit and focusing on the adult.
Sure.
It's always difficult. How can you take care of your child when I am anxious too? So what advice do you have for adults when they're facing this period of anxiety, whether it be COVID related or it's you're seeing kids behaving a little bit differently than you're used to?
So, just like we were discussing with children, adults have faced an entirely new issue altogether. It's not only about the illness. See, part of the issue is in past pandemics, it was all about the illness. Here it's also about the economic impact it has had, about the support system that they have had. They cannot reach out to their loved ones the way they used to. A lot of them are working from home. It just creates more commotion within the home environment. So there is no end to it. I think my best or first advice would be, when you are starting to feel anxious, it is all about uncertainty, because you are thinking of what's going to happen next. What's going to happen to my child? Where is my next paycheck going to come from? And the best antidote to uncertainty is a routine. So first and foremost, people should build up a routine. They should have time carved out to protect their own mental health. It could start from starting their day by accomplishing simple tasks. Even a relaxation thing such as maybe spending some time doing yoga exercises, meditating. 5-minute, 10-minute mindfulness is going to be a great start to the day. It gives you some clarity. Have the day as structured as possible so that you are not left to not knowing what's going to happen next. And then become more aware of your supports, your resources in the community. As I had briefly mentioned earlier, outsource problems to the professionals where you don't just know what to do next. Engage with your family members in positive thinking, because that ultimately helps the adult as well. So some good examples would be resiliency building exercises. This is a great time actually, to bond with everyone. It's interesting that everyone sees the pandemic's impact as being the whole world is different, but different doesn't mean negative. Different just means it's not the way it used to be. So look at the silver lining and try to be a little bit more proactive. One example, which I mean, there are so many things we can talk about, but what I think really helps adults, and for that matter children as well, is to start a gratitude journal. Take some time to reflect upon over the years. There are so many people who have touched their lives in a good way, but in our crazy lives that we used to live, we never got a chance to do that. So there are a lot of things that could be done, but at the end of the day, if it's impacting their own mental health, they should seek help also, because if you are not in a good position, you won't be in a position to help your child.
Fair. As I guess a follow-up step on that one, at times, you can try and do things for yourself, as you outlined. You can maybe do something for your spouse, your kids, but what if you see other friends or family members that are going through this same anxiety? Maybe they're depressed, maybe they're drinking too much. How can you help?
Yes, so it goes back to the point of I don't advise for people to become confrontational, because you don't want to distance yourself further from them, but come from a place of caring for the other individual. Acknowledge the fact that these are trying times, and then once you know your resources in the community, suggest to them that they may seek professional help as well. I think that will go a long way, because ultimately the message that needs to be given is, I digress here a little, but when we used to travel by air, I mean, a lot of people don't do that these days. The message that they always give you at the start is, if the oxygen levels go down, the masks are going to come out first, but put the mask on yourself first. Correct. So I think the message that needs to be given is, take care of your own self first, and that's what you can tell your friend as well. Don't stretch it. You are not in a position to help your own kids if you're not getting the help for your own self. So it's at times okay to be selfish about your own mental health.
And so we've talked about how we can better deal with our kids and their developmental issues, whether they be as they're getting older or due to COVID. We're also trying to help parents cope in this very trying time. We're entering into the winter. What do we do next? Because that's also a time with the cold, you tend to stay indoors. and it's generally not a fun time.
Well, I think it can be a fun time if we want to make it a fun time, but I totally get where you're coming from. There is actually the concept of winter blues, which COVID or no COVID always used to be there for exactly the same kind of things you mentioned. I think it again goes back to the concept of just because there is snow outside or it's very cold outside doesn't mean that the world necessarily has changed. There's still a lot of outdoor activities that could be done by kids, by adults, as long as they are following safe practices of doing things. We did touch upon certain things which I think will be very relevant, especially during these winter times, and those were on lines of resiliency building exercises. So when the families sitting together, keeping themselves warm during winter time, sipping on hot chocolate. This is also a time for bonding to take place, where I think there's a lot of value in parents talking about their own stories and sharing them with their kids, talking of their own. This indeed is a trying time, but not the first time in our history that this has happened. Sure. It's phenomenal for kids to hear from their grandparents who can talk about the wars and others, because that ultimately sends a very strong message to kids that this shall pass too, that the world is a safe place to be in, and ultimately we're going to get through this together.
Thanks, Dr. Singh. I think you've given some very good advice, offered some very good insight into our viewers. So I'd like to thank everyone for watching Let's Talk Health. Again, I'm with Dr. Singh, the medical director of our behavioral health program. Please look after future programs that we'll be running, as well as checking our website for future updates at www.stclares.com.